Hello, I am Dr. Preeti Sharma, Senior Consultant Pediatrician at Ankura Gachibowli, Hyderabad. Today I will be talking about why regular checkups and well child visits are important. Many parents feel that why should I visit a pediatrician for a simple vaccine or at regular intervals? I will meet the pediatrician only when my child is sick. So what do we do at these well child visits or well baby visits? We will be checking your baby's weight, height, in smaller babies the length, their head circumference. We will check them for any signs of vitamin deficiencies or any hemoglobin, if the hemoglobin is less, or iron deficiencies. We will also check if there are some skin pigmentation issues or any other general abnormality. Now you may say, I will just check the weight and height when I come for an illness. That is not correct. A single weight and height reading has no meaning in growing children. What is important is that your child should be gaining weight steadily, should be gaining height steadily. There is a certain amount of height a child should gain every year. If the child is not doing that, then we may have to think of causes like some vitamin D deficiency, calcium deficiency, thyroid problems. So these regular checkups will help us identify and start treatment for these common problems much earlier. If you'll keep waiting, then your child may start coming with other severe problems because of these deficiencies. Now coming to head circumference monitoring. In young children, especially up to 1 year, head circumference we check with a measuring tape the size of your child's head. This gives us a good idea how the child's brain is growing inside. The most crucial time of brain growth is from birth till 5 years, and especially so in the first 2 to 3 years of life. So in the first 1 year, anytime we feel that the child's head growth is falling behind or is not growing as per the child's age, then it is a reason for concern, and we can go ahead with tests and interventions earlier. Also, for younger babies, we will be moving the child's hands and legs and seeing if they are moving appropriately, their tone is normal, there is no tightness of any muscles. If we find that, then early treatment with physiotherapy, occupation therapy will have very good results. Subtle signs of hypothyroidism can also be picked up earlier on these well visits. Otherwise, you can miss it unless the thyroid has caused a major havoc with your child's body. Similarly, iron deficiency is very common in India, and if you come for these well visits, if we feel that the child's diet is lacking in iron, then sometimes we will start a low dose iron so that the deficiency does not increase. Otherwise, iron deficiency can affect your child's mental capacity, can make your child dull, irritable, and other problems. Other things which we look for during these well visits are your child's other development issues, like if the child is walking on time, sitting on time, and especially speaking on time. These days you must have heard about the term autism. Lot of autism cases are on the rise, and if you are going to your child's pediatrician at regular intervals, then we can identify the early signs of autism as soon as 1 year to 15 months of age. And in autism, you should know the earlier we start therapy, intervention, the better is the outcome. If I diagnose a child, say at 15 to 18 months, compared to if I diagnose the child at 3 years, I know the child I diagnosed at 15 to 18 months will do much better. And if you don't come for these regular visits, as parents, it is very difficult for you to identify the subtle signs of autism. Most of the parents approach the doctor when the child is 3 years and is not talking. But as a pediatrician, we can pick up these things early. And sometimes it may not be a disease which we are picking up. Sometimes we find parents are doing some things which are not good for the child unknowingly. For example, screen time. Many parents feel it's okay, let my child see screen. All children are seeing mobile these days. What's wrong? If we identify that the child is having too much screen time, we can give give you an early warning and explain to you. Similarly, in diet, many parents will keep giving too much milk. So when you come for a well child checkup, when we ask about the diet, we will tell you your child needs this much ml milk, this much fruit, this much vegetable. So overall, along with you, we as pediatricians can help in the complete and healthy growth and development of your child. So please visit your pediatrician at the time of all the vaccines. But after 2 years, the next regular vaccine is at 5 years of age. So I would recommend every year just visit your pediatrician. Some parents go for yearly flu shot. If you're going for that, during that time you can have a healthy child checkup. But if not, then 2 years, 3 years, 4 years, 5 years, 6 years, 7 years, like that, at least once a year, visit your pediatrician.